It's 1027, 1035 WICY on this Wednesday morning. Right around 9:40, we dive inside the community that is with Dr. Todd Whitman of Hyde Medical Center. And Todd, tell us more about a couple of other roles that you have.
So I'm an oncologist both here at Hyde and at CVPH, and currently I'm serving as the Assistant Chief Medical Officer at both institutions.
Yeah, we've been talking about the impacts of COVID-19 and how, you've seen them firsthand based on what you do. And what do you have for us today, man? I know it's something different every week.
It is. So one thing that I really wanted to focus some light on today is what we call our Curbside Telehealth program. So as you're aware, there's been lots of work across the country to get people connected with their healthcare providers through what we call telehealth. That can either be a telephone visit or even better, a televideo visit. And so here at Hyde, we've had lots of patients who haven't had access to technology to be able to do televideo visits, or perhaps if they have the technology, they're not familiar enough with it to be able to access that. So we've created a program where people can drive up. It's a pre-scheduled visit with your provider. You drive up, and someone will actually hand you an iPad that's already preloaded with your provider on the other side. So it's a great way to allow people to access care and get connected with their healthcare providers.
This is
here in town.
Something that they leave their home to go do. Is there something they can do in the comfort of their own home for certain people?
It is, and we're working with as many people as we possibly can to do that from home. But for those people who don't have the technology or the familiarity, it gives them a chance to, in a very safe environment, just drive into a parking lot, have one of our healthcare one of our nurses hand them an iPad so that they can connect with their provider without going into the office or being exposed in other ways to other people in the community. So you're in the safety of your car.
All right, I got an A and B question here. So I just want to know, how long has this been going on for, this type of program, and what kind of results have you seen in the short term?
So we just started this program yesterday.
Okay.
And we had a few patients go through, and they were thrilled with it. And so we're really happy to be able to offer this to the community.
Yeah, no, okay, never mind. It's very, very fresh, but obviously promising early on. And I think it's the necessary way for them to be able to go about this, right, Todd?
Absolutely. It's great. And we've actually partnered with one of the pulmonologists at CVPH Medical Center in Plattsburgh, and so people who would normally travel to the pulmonary clinic to have care for their lung diseases are going to be able to use this system to access Dr. Arja and his team there. So it's really great, and we're hoping it'll expand and be able to provide access for people who wouldn't otherwise have it.
Right. That's what this is all about, taking advantage of these opportunities, and we're blessed to have them, Todd. And we talked about we had mask guidelines we talked about a couple weeks ago, Cuomo's executive order. We're well past that now here a couple weeks later. Where do you think we're at overall? And we could be in for another month or two, maybe. Who knows with this?
Yeah, it's really difficult to tell. As we've so-called flattened the curve, it does extend out the amount of time that we'll continue to have to participate in social distancing and really trying to protect the community and ourselves as we go through this. But I think people in Malone are just doing an outstanding job. Franklin County has very low infection rates relative to other places in the state, and I think that's because the community's been so great about social distancing and really protecting everybody.
I've seen it firsthand with the limited amount of times I've gone out with, not just elderly wearing masks, but pretty much everyone, and they're saving potentially the elderly's lives. So we have to look at it as like that way too,
Absolutely.
Todd, it's been great having you these last few weeks. Are we going to be chatting next week, perhaps?
We are.
We're looking forward to it. I mean, seriously, a week, I don't know what kind of sense of time frame you have. Feels maybe long, or maybe it's flying by for you because you're working so hard, but...
The weeks are flying by. It's an interesting time.
Yeah, it is. I think we're both blessed to be, having jobs right now, and it allows me to stay busy. And I have to work even harder right now to provide for the community all this information and talks with people like you. So I appreciate it.
Hey, and we appreciate you. I hope you have a great rest of the day.
Yes, sir. And until next week, okay?
Sounds good.
All right. It's Dr. Todd Whitman with us, representing Hyde Medical Center. We meet with them every single Wednesday at 9:40. It's inside the community on 1027 and 1035 WICY.